everyone, and welcome back to another Medicise video. So today's video is on hemorrhoids. So hemorrhoids occur when the veins in the anal canal become inflamed and swollen. Now these veins play an important role in assisting the anal sphincter in maintaining continence. And when these veins become abnormally enlarged, they are called hemorrhoids and can start causing symptoms for patients. Now, the main risk factor for developing hemorrhoids is raised intra-abdominal pressure. So, for example, if you have constipation and end up straining when you go to the toilet, having a chronic cough or ascites, because those, again, increase abdominal pressures. Hemorrhoids are also common during pregnancy due to the high pressures in the abdomen, but they usually get better after giving birth. Now, another risk factor for developing hemorrhoids is increasing age, and this is because the anal canal weakens with age, so patients are more susceptible to developing hemorrhoids. So hemorrhoids can be found inside the anal canal, but sometimes they may hang down and come outside the anal canal. And hemorrhoids are classified according to how far the hemorrhoid comes out. So there are 4 grades, and if you have a look at this image, grade 1 is a hemorrhoid over here, which is high up in the anal canal, that can't be seen by the naked eye, whereas grade 4 over here can be seen outside the anal canal. So grade 1 is defined as a hemorrhoid with no prolapse, i.e. the hemorrhoid doesn't bulge outside of the anal canal. And these hemorrhoids can only be seen on proctoscopy. Now, proctoscopy is a procedure involving a hollow tube with a light at the end, which allows visualization of both the rectum and the anus. So you can only see a grade 1 hemorrhoid using a proctoscopy and not via the naked eye. Whereas a grade 2 hemorrhoid is defined as a hemorrhoid which prolapses with strain but spontaneously reduces. So a grade 2 hemorrhoid can bulge out of the anal canal when the patient is straining, for example, whilst on the toilet or whilst lifting heavy objects. However, the hemorrhoid then spontaneously reduces back inside the anal canal. Then you have grade 3 hemorrhoids, which is defined as a hemorrhoid which prolapses with strain, but you have to manually reduce it back. So when the patient is straining, the hemorrhoid bulges out of the anal canal, and for it to go back in, patients have to manually push it back into the anal canal. It doesn't spontaneously reduce like grade 2. Grade 3 requires the patient to manually reduce it back. Now, grade 4 hemorrhoid is defined as a prolapsed hemorrhoid, which is irreducible. So the hemorrhoid bulges out of the anal canal and cannot be pushed back in. So how does hemorrhoids present? Well, patients classically present with painless, bright red bleeding. So often patients aren't in any pain at all, and the only symptom they present with is bleeding. Now, unless the hemorrhoid is particularly large or thrombosed, patients often won't be in any pain, they just might be in a lot of discomfort. Now, when taking a history from patients presenting with hemorrhoids, they will often describe that they notice the bleeding on a toilet paper, or they notice drips of blood on the toilet seat, or even on the surface of the stool, as opposed to being mixed into the stool. So when patients describe that blood is on the surface of the stool and not mixed in, it suggests that the source of bleeding is coming from near the anal canal as opposed to higher up in the digestive system. If the source was higher up in the digestive system, patients will report blood mixed in with the stool as opposed to blood just being on the surface of the stool. Now, another clue that tells us that the source of bleeding is lower down in the digestive tract is that the blood is described as bright red in colour. Now, if the blood was to come from higher up in the digestive tract, for example from an upper GI bleed, the blood would be dark red in colour, as it would be oxidized throughout the tract before it reaches the anal canal. So it will be much darker than the blood seen in patients presenting with hemorrhoids. So the fact that the blood is bright red in colour and found on the toilet paper or on the surface of the stool suggests that the source of bleeding is somewhere from lower down. Now, other symptoms that patients may experience is mucus being discharged, and this discharge can cause itching as the mucus irritates the skin. Other symptoms include feeling of fullness or bulge in the anal canal, so that's the discomfort that patients might feel. And if the hemorrhoid is completely prolapsed, then you may be able to feel a mass, and that's the grade 4 hemorrhoids that we were talking about. So it's also important to remember that some patients may be completely asymptomatic and won't feel any symptoms at all. Now, in these cases, the hemorrhoids are found incidentally. So how do we diagnose hemorrhoids? Well, if we split up our investigations into 4 categories: bedside, bloods, imaging, and special tests. The bedside investigations are crucial, so it's important to do a digital rectal examination in anyone presenting with PR bleeding. Now, when we perform the digital rectal examination, we may be able to pick up the hemorrhoids straight away. If not, that's when proctoscopy is useful. In addition to bedside investigation, blood tests are also important, particularly if there are concerns of anemia from prolonged bleeding. Other tests include doing a colonoscopy or a CT scan to rule out colon cancer if there's high suspicion, but most of the time a flexible sigmoidoscopy is performed. Now this is a flexible tube with a camera on the end and is inserted into the anal canal, through the rectum and into the sigmoid colon, and this is to rule out rectosigmoid cancer. So the management of hemorrhoids depends on its grade. So if it's a grade 1 hemorrhoid, conservative treatment is sufficient. So it's important to give patients dietary advice, encouraging them to have a high fiber diet and increasing their fluid intake to make their stool softer and easier to pass. This will help to reduce the pressure on the veins in the anus caused by straining when going to the toilet. Other conservative management includes taking laxatives, topical analgesia, or topical steroids to help with the inflammation, and it's important to advise them to avoid straining or heavy lifting. Now, for managing grade 2 hemorrhoids, conservative treatment is not enough. So one way to manage grade 2 hemorrhoids is via rubber band ligation. So this is when small elastic bands are tied tightly around the hemorrhoid, reducing the blood supply. So this causes the hemorrhoid to die and fall off in about a week or two, and the area remaining will naturally heal. Another method is sclerotherapy, and this involves injecting an oily solution into the hemorrhoid, which over time will cause the hemorrhoid to gradually shrink or shrivel up. To manage a grade 3 hemorrhoid, rubber band ligation is the only option. And for grade 4 hemorrhoids, the most effective procedure is to perform a hemorrhoidectomy. So that's a surgical procedure to remove the hemorrhoid. Surgeries are not often performed on hemorrhoids. However, if they are causing the patients a lot of problem, they can be performed. Now, in any patients presenting with PR bleeding, it's important to think of other differentials, such as colorectal cancer, perineal abscesses, inflammatory bowel disease, anal fissures, and diverticulitis. Now, the main complication to be aware of is that the hemorrhoids can become thrombosed. So a thrombosed hemorrhoid occurs when a blood clot forms inside the vein, and that causes obstruction of the blood flow, causing swelling and discoloration of the hemorrhoid so that it appears as purple/blue in colour as opposed to being red. Alright, so that's all on hemorrhoids. So now it's time for our quiz. So there's a total of 6 questions in this quiz, and 15 seconds will be given for each question. If you feel like you need more time, just pause the video at any point. Alright, let's start with the first question. Which of the following symptoms are not common in hemorrhoids? Bleeding, abdominal pain, mucus discharge, or pruritus? Abdominal pain is not a common symptom of hemorrhoids, so most patients present with painless PR bleeding. This can be associated with mucus discharge, and this discharge can also cause itchiness, also known as pruritus. They may feel a bulge in the anal canal, or they may not have any symptoms at all. Alright, let's have a look at the next question. What is the definition of a grade 3 hemorrhoid? Alright, let's have a look at the answer. So there are 4 types of hemorrhoids, and a grade 3 hemorrhoid is a hemorrhoid that prolapses with strain but manually reduces. So grade 2 and grade 3 are quite similar. However, grade 2 reduces spontaneously, whereas grade 3 requires manual reduction. Alright, question number 3. What are the conservative management methods of hemorrhoids? Alright, let's have a look at the answer. So some things that you could have mentioned is having a high fiber diet, increased fluid intake, analgesia, avoid straining and avoid heavy lifting, using laxatives or topical steroids. Alright, question number 4. What bedside investigations can be performed in patients with suspected hemorrhoids? Alright, let's have a look at the answer. So a digital rectal examination and a proctoscopy can be performed by the bedside to see if patients have hemorrhoids. Now, a digital rectal examination can identify hemorrhoids that are bulging beyond the anal canal. And for internal hemorrhoids, such as grade 1 hemorrhoids, only a proctoscopy can be used to identify them, as they cannot be seen by the naked eye. Alright, question number 5. How are grade 2 hemorrhoids managed? Alright, let's have a look at the answer. So in addition to conservative management, patients will require either rubber band ligation, which involves tying tight rubber bands around the hemorrhoids to cut off the blood supply and causing them to eventually fall off, or sclerotherapy, which involves injecting an oily solution into the hemorrhoid, which eventually will make the hemorrhoid shrivel up. Alright, last question. A patient presents with a hemorrhoid appearing swollen, purple, and very tender. What is the likely diagnosis? Alright, let's have a look at the answer. So the answer is a thrombosed hemorrhoid. Now, thrombosed hemorrhoids are very painful. They are purple/blue in colour, and they can be seen bulging out of the anal canal. Alright, good job guys. That's all the questions for today, and here is a summary slide on everything that we spoke about today. Thank you so much for watching, and if you do like this video, please do like, share and subscribe, and comment below for any other topics that you'd like us to cover. Hope you have a great day and see you in the next video.